Hello, I'm Angela Vossen from Core Clinics in Warwickshire. There's so much information on the internet at the moment, it can be overwhelming. So we thought it would be easier for you if we recorded a video for our patients and potential patients to let you know about what's happening in the clinic and the changes we're making to make sure that you're safe. So if you'd like to follow me, we'll take a tour of the clinic. On entering the clinic, there's no need to touch any door handles, everything's open. You're welcome to choose a disposable glove. Alternatively, we have hand sanitizer on the way in, which we've had that for a long time, but we do require all of our patients to use these. Alternatively, you can walk straight through the clinic and go to our hand washing facilities, which are just around the corner there, and then come back to reception. Regular visitors to the clinic will see that we've made some changes in the waiting room. In line with social distancing advice, we've removed some of the waiting room chairs. On arrival, we would ask you to sit in a chair which is as far away as possible from anyone else who's in the waiting room. We've also made additional waiting spaces available so that at no time is the waiting room crowded. In our reception area, we have hand sanitizers, alcohol wipes and equipment wipes. We're introducing a variety of different ways to pay to minimise anybody having to actually touch our chip and pin machine, and we'll explain that more to you in due course. If you do have to use the chip and pin machine, we have hygienic wipes which will be used after every person has handled it. We have some additional waiting space here now. In the corner here, our children's play den, we are asking patients at this point in time, if they do bring their children into the clinic, that they keep them close with them, observing social distancing. We are not going to allow people to use the children's play den because we can't keep it constantly hygienic. If it is possible to have children who are not patients themselves not come on your visit, so stay at home or in their childcare setting, that would be appreciated. For our discal injury patients, we are continuing to provide IDD therapy. Many patients are having elective surgeries cancelled by the NHS at the moment. So people that are managing chronic pain conditions and who are on waiting lists for hip replacements and knee replacements and various orthopaedic surgeries are going to be in desperate need of conservative care management. That's what our polyclinic specialises in, and that is why we are so determined to do everything we can to keep serving those patients and taking the pressure off the NHS. As a point of interest, we would suggest at the moment that people don't actually use hand air dryers. They're generally considered less hygienic, and particularly at the moment you don't want anything being blown around. And that's why we actually recommend the use of these single-use disposable paper towels, and that you thoroughly dry your hands and dispose of them in the bin. Any treatments which do require you to have contact with a clinical couch, we have single-use disposable towels. We have obviously single-use actual towels if necessary. And in between every patient visit, the clinician will wipe down the treatment table and anything which has come into any contact with themselves or the patient. So we have alcohol equipment wipes and we have universal Clinell wipes. We also have face towels, so if your face is down for a neck treatment or a shoulder treatment, again, that's disposed of every time and the whole thing is sanitised. The clinic specialises in the management of chronic pain conditions, rehabilitation for injuries and sports performance. At the current time, with gyms closed and you may be finding it difficult to exercise, particularly if you need instruction so that you exercise safely with an injury or back pain or a discal problem, we have a space here for you to do this. Light and airy room, you would only have yourself and our experienced practitioner in here, which could be our physiotherapist or one of our exercise professionals. All equipment is wiped down again with the same hygiene wipes after every patient interaction. All of our clinical gowns, towels and any other fabrics that we use in the clinic are washed after every single patient use on a long high heat cycle. We regularly use Dettol washing machine cleaner as well. Throughout the clinic we have plumbed filtered water dispensers. You can help yourself with a single-use cup. You don't have to touch any part of the equipment, you just use the cup, and then you can dispose of it with a pedal bin.
Some of the changes that we have made is that to not only wipe the table as we normally always do, but also the handles and all the different surfaces included. We are now also wiping all the different equipment and surfaces after every single patient visit. Unlike normally, we won't be shaking hands this time, but I will be inviting you to use the hand sanitizer, as will I. After that, I will then be using some clinical gloves so that every surface that I end up touching will not touch you. And then at the end of the visit, I will be disposing of my gloves. Sadly, no handshakes, but I'll be looking forward to seeing you at your next visit.